Nigeria, Africa's most populated country, rich in natural resources, and yet home to some of the poorest people on the planet. A nation where health problems abound and where clean drinking water is scarce. We are the Tulsi Chandrai Foundation, or TCF, and our heart resides in Nigeria. TCF is a charitable trust established by the Chandrai family and like-minded donors. Its goal is to address some of Nigeria's most vital needs and through its projects bring hope to hundreds of thousands.
The partnership with Tulsi Chandrai Foundation has been very gratifying for the T.Y. Danjuma Foundation. As a matter of fact, the Tulsi Chandrai Foundation is one of our legacy grantees. We study the proposals they make and provide financial resources for them to carry out these projects for us. And they have been among the star grantees that we have had.
In Nigeria, TCF has implemented 3 projects. The Mission for Vision project, the Mission for Primary Health project, and the Mission for Water project.
The foundation itself was set up in 1992, meaning that this is over 20 years old. They have been doing marvelous work in various communities. I do know that they worked in at least 5 states in Nigeria. The model that they have put in place is affordable. It is really for the poorest of the poor.
Since its inception, the Mission for Vision project has set up hospitals in Birnin Kebbi, Calabar, Katsina, Owerri, and Yola. State governments, through personnel developed by TCF, now manage 3 of these projects. The model is very simple. Partner with the local government. Identify the patients through outreach camps. Arrange hospital appointments. Do a final checkup. And then perform a simple operation using the best doctors and equipment. When the bandages come off, one day after the operation, the results are there for all to see.
I came here led by hand. They brought me here as a blind person, and I'm seeing everybody. I can see with my eyes, so I'm very happy.
Yeah, I feel happy. More than before. See your mouth. I see your teeth.
This gift of sight, though, would not be possible without the generous support from the Nigerian government and local communities who provide equipment, infrastructure, and local personnel. This is a model that truly needs to be expanded all across the country.
Basically speaking, although I am doing surgery here in Cross River, Calabar, I have patients coming from surrounding neighboring states. Even some patients come from the neighboring country, Cameroon.
In our continuing vision to bring sight back to those with curable blindness, TCF is setting up a super specialty eye hospital in the country's capital in partnership with Aravind Eye Care Institutions, one of India's largest eye care providers. When fully functional, the hospital would be able to perform about 15,000 surgeries a year, in addition to having a full-fledged training center for doctors, paramedical staff, and eye care managers. It will perform at least 50% of all surgeries free of cost.
As with most of sub-Saharan Africa, the eye care needs in Nigeria also is enormous. It's not only for the basic eye care services like cataract or glasses, where there is some availability. When it comes to more advanced conditions of the retina or glaucoma or the cornea, the services are almost non-existent. It is in this broad context that Tulsi Chandrai Foundation and Aravind Eye Hospitals are coming together. The Chandrai Foundation already has quite a legendary track record in Nigeria of serving the community on multiple fronts, and most notably in eye care.
The Mission for Primary Health project began by setting up pilot projects in Eniosa, Adana, Isu, Yola, and Gachia. Its goals provide essential frontline medical care, especially for mothers and children in deprived rural areas. Reduce the distance that rural women have to travel to access basic health care. Ensure that all medicines that are given are genuine. Deliver free health care to pregnant women and infants till the age of 5. Bring this health care to the very doorstep of communities. These goals have been addressed through a very simple yet effective model. At the grassroots level are health posts. These are established in outlying areas for the surrounding population, serving about 2,500 people each. These health posts are grouped into clusters of 10, with each group overseen by one of the 3 or 4 health clinics. In turn, these health clinics are managed by the primary health center in a government building. This model has secured the health and well-being of over 1 million mothers and children since its inception. Encouraged by this success, TCF entered into a technical collaboration with the Cross River State Government to bring primary health care to the entire state. This project now covers a population of 3 million in 18 local government areas.
My first request was that they should partner with Cross River State, but not in one local government or in one community. I wanted Tulsi Chandrai to work with us in achieving or revisiting this vision across the state. Initially for TCF, it sounded like a tall order, but I assured them that I was committed and the political will was there to ensure that we give them the support and the partnership to reach as many cross-riverians in very rural communities who needed these services.
You know, parents always afraid of going to children's clinic, but the treatment was very free because they go to other hospitals. They spend a lot of money. But when I came, I discovered this place. After the treatment, doctor could not collect even 10 kobo from me.
TCF, along with the Cable Ram Foundation, has now set up another primary healthcare center in Zaria in Kaduna State. TCF would like to build such partnerships with all 36 of Nigeria's states. Since the project began, the TCF Mission for Water project has rehabilitated 3,887 hand pumps in partnership with UNICEF, the Federal Ministry of Water Resources, state governments, the T.Y. Danjuma Foundation, and other like-minded donor agencies. When the project started, it had one single goal: to ensure that people did not have to trek miles to gather water that was contaminated with waterborne diseases and thus unfit for human consumption. To achieve this mammoth task, they found a simple and cost-effective solution. TCF started with the understanding that the cost of reactivating a non-functioning borewell would be just a fifth of what it would cost to drill a brand new borehole. The next step was to identify from amongst the thousands of borewells and pumps sunk across the country those that could be made operable. They then rehabilitated these hand pumps in partnership with the local community. Once the community was mobilized, committees were formed at each hand pump. After this, local village workmen were trained to repair and maintain the hand pumps. This made certain that the community played an integral part in ensuring their own water security. Through its by the people, for the people concept of maintenance, TCF has been able to target a 75% functionality rate of hand pumps against the current national average of just 52%. With an average of 600 people benefiting from each rehabilitated hand pump, clean drinking water is changing the lives of communities.
Before the borehole came, we were drinking water from the stream. But after the borehole came, we realized that what we were drinking was not good enough for us.
TCF's ultimate goal is to set up similar water projects in each state so that every Nigerian can have access to clean and safe drinking water.
We would like to see this model replicated in many parts of the country because provision of safe drinking water, as we have said, is a fundamental for health care, preventive health care, and reduces the cost of treatment of unnecessary ailments.
Through the success of the Mission for Vision project, the Mission for Primary Health project, and the Mission for Water project, TCF has proved that well-conceived, well-managed projects can irrevocably change lives.
I think that if we can replicate this model all around the country, we'll be better for it. Because it's basic, it's simple, and it addresses the real problem of the people.
However, the Foundation's goal of bringing sight, health and water to each and every Nigerian who needs it is far from complete. Millions await deliverance.
TCF's vision, right when it started, was that every Nigerian should have access to primary health care, clean drinking water, and good quality eye care. We've proved that it can be done, and now we're going even further by setting up a super speciality hospital, right, in Abuja, where we hope to break ground by April, May this year. For TCF to be taken across the country, we need government support. We would like the federal government to adopt the 3 projects that we have started with in TCF, to try and scale it up throughout the country. My dream today is one day every Nigerian will have these facilities.